Welcome to Perimenopause How. This video is on the topic of antidepressants and the prescription of them to help with perimenopause symptoms. Some women are surprised, shocked, angry, disappointed when a doctor offers them antidepressants, as often a woman is expecting the doctor to prescribe HRT or hormone replacement therapy. But please rest assured, your doctor is not incompetent. They're not trying to fob you off, and they do not think it's all in your head. There are many, many reasons why this is now a reasonable thing for a doctor to do. Some while ago, there was an important and very large study that showed that HRT increases the risk of a woman developing breast cancer. So now it isn't the first thing that a doctor will prescribe for you. You may have to try other things first. And in fact, now you're aware of this knowledge, perhaps you might want to evaluate your expectations of how you're going to treat your symptoms too. Now, if your worst symptoms are mood related, if you're feeling primarily anxious or depressed, or you have mood issues related to perimenopause, then actually an antidepressant is a really sensible option for the doctor to offer you. And the reasons are this: HRT does not always help with mood problems. We don't really understand why this is. It seems logical that since your mood is caused by your hormones, that taking hormones should help. But in practice, antidepressants are actually more reliable at treating mood disorders. That's just a fact. Some women do say HRT helps, and some women say that it didn't help. And some women end up on HRT and antidepressants. So taking that into consideration, trying the antidepressants first is actually quite a good strategy. Unlike HRT, antidepressants do not increase your risk of contracting breast cancer. Also, every woman who still has a uterus, if they take HRT, then they have to take progesterone too in order to protect the uterus from cancer. So, unless you've had a hysterectomy, you're going to have to take progesterone too, and progesterone can actually cause depression in some women as well, or anxiety. Progesterone is the hormone of PMS and pregnancy. So if you think of raging PMS and your worst PMS, sometimes progesterone can cause this in women. It does for me, so I won't be taking HRT either. Antidepressants can also help some of the symptoms of menopause, like hot flashes. We do have another presentation about other medicines that goes into more information about this. And also, if you also watch the video about hot flashes, it will help you to understand why medicines that sedate you a little can help reduce your hot flashes. It's true that antidepressants have some undesirable side effects. Sexual side effects can be very annoying and upsetting. But the dose of antidepressants that is normally prescribed for hot flashes is usually a bit lower than one that is prescribed for depression. So actually the dose may be lower, but then again, it may be the usual dose if you're also taking it for mood problems. So if you're primarily taking it for depression, you might want to try an antidepressant called Wellbutrin first. If you're in the UK, your doctor will probably call it bupropion, not Wellbutrin. That's usually an American brand name. But Wellbutrin can actually increase libido, and it doesn't usually cause weight gain or sexual side effects of the type that SSRIs cause. Another thing to watch out for is that some people do go through a spell when they first start antidepressants where they feel worse. This usually happens at 2, 3, 4 weeks through treatment, And by about 6 weeks into treatment, that's usually gone. But actually, this can cause suicidal ideation. You can feel much worse than you did when you started. So, if this happens to you, please seek help from your doctor. If you're in the UK, you can ring the NHS helpline on 111 and ask them if you can't get a GP appointment. If you need to stop taking the antidepressant, withdrawal effects can be unpleasant, but only if you stop immediately. If you draw up a program with your doctor that allows you to reduce the dose slowly, this is the best way and keeps withdrawal symptoms to a minimum. Really, you can take literally weeks or months to stop taking an antidepressant. Just plan for this to take some time. Don't be thinking you can do it straight away. Please try your best to ignore the scaremongering comments that we get in the group. Some people are very prejudiced about taking a medicine for depression or for feelings. They consider it to be shameful in some way. There isn't anything shameful about needing help during menopause. Many women find it difficult. In the past, we had no medicines apart from herbs and whatever the wise woman in your village could suggest that you took. But, some women had a very difficult time and, didn't make it out of the other side, basically. So don't feel ashamed. It might not be something that you take forever, but if you need help at the moment, that's fine. Just take the medicine. Don't worry what other people think. And you don't have to tell them, you don't have to share it with them if you're taking an antidepressant. Many of the comments that we get in the group are not based on personal experience, but hearsay, by which we mean their aunt or their friend said such and such about taking that medicine and what a hard time they had coming off it. But people stop and they stop cold turkey. You don't know exactly what they did when they decided they wanted to quit, whether they took their time coming off it or whether they just stopped. If you just stop it suddenly, you will have an unpleasant time. You have to reduce your dose slowly. It can take weeks, not days. You should not just stop suddenly, but you should be aware when people say they had a hard time coming off it that maybe they didn't stick to the plan of coming off it slowly, or they tried just to stop it straight away, cold turkey. It doesn't work well. So, in conclusion, antidepressants are one of many options in perimenopause. They are really helpful when the dominant symptoms are emotional, so anxiety or depression, and those can really be overbearing at this time. They're useful when a woman cannot or does not want to take HRT, and they are a useful adjunct if HRT does not help enough. In light of the new statistics about HRT and breast cancer, they're one of a few options a patient can try first before they decide that they are going to use HRT. It's wrong to think that HRT is the only helpful medicine in perimenopause. In addition to antidepressants, there are a great many other treatments for various symptoms, but we do have another video on that topic. So, before I close, if you found this video interesting, then like and subscribe and all that YouTube jazz. I'd like to thank you for